extend my profound gratitude to our host, the government of Zambia, who has been an excellent partner in shaping this year's conference. The themes of this year underscores a fundamental truth that health is not only a matter of medical science, but also a policy, equity, and global cooperation.
E.G. said no single individual or institution can deal with our current situation. It requires partnerships.
Namibia acknowledges the centrality of investing in robust, resilient, and sustainable health systems, particularly for pandemic prevention, preparedness, and response, in order to protect lives, livelihoods, and economies.
This platform that has been provided to us at Oxford, to all of us in this one today, is unique. Yes, it has happened before, but it is unique in the sense that it is talking about health in a holistic way. Health for one, health for families, health for countries.
Particularly on behalf of my colleagues in the African continent, in the African region, saying how proud we are of you, veterans, how much we really deserve this recognition by the Africa CDC.
Son of Africa, I'm deeply humbled to accept this award.
Between public and private sector, there's a trust gap, there's misperceptions on both sides, and so these federations come together to bridge that unnecessary gap.
Africa simply cannot, should not, and will not wait for others to do for us what we must do for ourselves. The African Union showcased how collective leadership is of paramount importance on issues that impact the health security of the continent. The African continent was the first to adopt a continental strategy and approach to the fight against the pandemic.
D'autres vous diront que les femmes ont en réalité beaucoup de poids sociaux et qu'on ne pourra jamais, arriver à avoir des positions de leadership. Ce qui fait qu'avec tous ces préjugés, c'est normal qu'on soit dans cette situation. Mais ce que je voudrais dire aussi, c'est qu'en matière de santé, les femmes sont celles qui prennent en charge, que ce soit la prévention comme le traitement, dans les familles ou dans les structures sanitaires ou même dans les politiques au niveau communautaire.
Transformative leadership is not merely a concept, but a call to action. A call to reform our national plans, strategies, policies, and systems to create a healthier Africa for all.
Our policymakers don't just come to launch the conference and go away, but they need to walk the journey with us.
So with smallpox, we also ended up being the first disease to be eradicated. And this shows when there was a concentrated global effort to eradicate smallpox, which was quite successful.
We would like to take this as really a dialogue, and as I say, a discussion that is aimed at giving us clear next steps on where the continent needs to go when it comes to strengthening trade in pharmaceuticals and linking the manufacturing of medical products and technologies to what we are doing through the Continental Free Trade Area, and ensuring that whatever is done at the continental level really facilitates movement of medical products and technologies within the African medical products regulatory system.
So in the first ever global situation analysis launched last year by WHO on IPC programs, again points out the burden is going to be borne by LMIC countries. For every 100 patients that go into hospital, 7 of these in the high income countries are at risk of acquiring a hospital-acquired infection, while it's double the number in the LMICs.
When we want to control outbreaks, such as Ebola outbreaks, you need to involve really all the sectors that are concerned by the problem. And most importantly, you need to engage the community, the affected community, and the community who is living around.
So let me quote some of the prominent leaders' views about GEEP, and some of them are in this room with us. According to the Director General of Africa CDC, Dr. Jean Cassel, GEEP has the power to bridge critical workforce gaps, expand laboratory capacities, and reduce supply chain delays across Africa.
What we got here are ideas that we can go and start to prototype and see where we go. Next time, I think next year when we have the conference like this, it would be really great to hear from some of you here that, you know what, we went and we started using Zing taxis, and guess what? We were able to do XYZ.
We need a new approach. One that employs systems thinking to really understand the complex dynamics within the health system, and one that will help us to collaboratively develop effective and sustainable solutions. Systems thinking for health involves deliberate and comprehensive approaches to map, to measure, and to understand the dynamics within the health system.
We call upon member states to, 1, invest progressively in NCD services, recognizing their escalating value on their role in driving catastrophic health spending, and 2, incorporate health promotion and disease prevention measures using the World Health Organization menu to cost-effective intervention into national policies to enhance population resilience.
I think the most recent lessons that we are learning with COVID-19 and all the other large outbreaks that we've seen on the continent, whether it is Marburg, it is Ebola, it is cholera, all these have really taught us that if we don't have good monitoring for mortality, then we truly don't know the burden of disease that we have. We truly don't know the burden of other health challenges that are there within the community.
What we want to do is to be more deliberate about what we want to achieve with the community of practice. Is it going to be problem solving, or is it going to be policy influence? We could have 2 very different communities of practice on the same domain, but with those 2 objectives.
We are really intentional in Nigeria to end tuberculosis. So we have a range of intervention. We have community screening. This community screening is done by community-based organization and community health workers.
To the different institutions, go to WHO, ask WHO what to be informed, where we stand in this discussion of the pandemic treaty.
We all know that ultimately you cannot extinguish the human desire for freedom. That is the ultimate thing that moves and shapes all of us. So what does freedom look like for women and girls? Who listens to them?
We had just over 1,500 delegates in person here in Lusaka, and a total of about 30,000 participants joining our various live stream channels. We had 9 plenaries, 18 parallel sessions, and 3 special sessions.
If there is no seat at the table, this time we will bring our own furniture. We will not sit at the back of a room. We will not sit at the back of a room nor allow African lives be sacrificial lambs for medical experiments.
Thank you, everyone. And truly, this was the conference for Africa, in Africa, designed by Africans. That is extraordinary.
Over the past few days, you have engaged in meaningful discussions. You have shared invaluable knowledge and forged connections that will undoubtedly contribute to the advancement of public health across the continent and the entire globe.
We said in Africa that all regions matter for us. This is why I have the privilege and the honor, on behalf of 1.4 billion Africans, on behalf of my colleagues from Africa CDC, to announce that the next CPHIA will be hosted for the first time by a Francophone country, a northern country, that is Morocco.
It was very magnificent. It was very. I think this organization is very intensive, and we learn a lot with many partners.
I come from an organization called Women in Global Health, and we have a big presence in Africa. So I've been very excited to meet a lot of our African chapters, and we're just having side events and getting to meet a lot of people and discuss.
It's been exhausting. And exhausting because it's been so good. It's been so good. There's been amazing conversations, amazing people, extremely well organized. I wish there was 5 of me to have gone to all the different things. I think it's been fantastic. So I'm going home very tired, but very energized. So thank you.
And with this, next slide. With the success of the smallpox eradication program, WHO then launched the concentrated global effort to use vaccines as a public health strategy by launching the expanded program on immunization in 1974. And at the time, there were 6 antigens, which are indicated here. Next slide. And following that, with this concentrated global effort, there was increased coverage across the world with these antigens. And what we found in the next slide was that vaccines have changed our lives. Over the next 2 decades, there was a great reduction in the vaccine preventable diseases that were targeted then. More than 90% reduction in all those diseases that were targeted in that first approach. And here in Africa, we can cite cases of measles in some parts